The unspoken truth about cataract surgery. Imagine stepping into the bright, sterile room of your cataract surgeon's office, filled with hope and anticipation. You've been told that cataract surgery will restore your vision, bringing clarity to your world once again. But what if there's more to the story? What if there are secret side effects that your surgeon never mentioned? Let's embark on a journey to uncover the hidden truths behind cataract surgery and reveal the 5 common side effects that are often kept in the shadows. Glare and halos, the unexpected light show. One of the most surprising side effects of cataract surgery is the appearance of glare and halos around lights. Imagine driving at night and seeing bright, starburst-like patterns around streetlights and headlights. This phenomenon can be disorienting and even dangerous, especially for those who drive frequently. The science behind it. When the natural lens is replaced with an artificial intraocular lens, IOL, the way light enters your eye changes. The new lens can cause light to scatter, creating glare and halos. This side effect is more common with certain types of IOLs, such as multifocal lenses, which are designed to correct both near and far vision. Coping with glare and halos. While glare and halos often diminish over time as your brain adjusts to the new lens, some patients find them persistent. Using anti-glare glasses or avoiding driving at night can help manage this side effect. If the problem persists, consult your surgeon for possible solutions. Dry eyes, the unseen irritation. Dry eyes are a common complaint after cataract surgery. You might experience a gritty, burning sensation in your eyes, making it uncomfortable to read, watch TV, or use a computer. The underlying cause. During cataract surgery, tiny incisions are made in the cornea, which can disrupt the natural tear film that keeps your eyes moist. Additionally, the use of eye drops before and after surgery can contribute to dryness. Managing dry eyes. To alleviate dry eyes, use lubricating eye drops as recommended by your surgeon. Staying hydrated and using a humidifier can also help maintain moisture in your eyes. If dry eyes persist, your surgeon may suggest additional treatments, such as punctal plugs or prescription eye drops. Floaters, the unwelcome guests. Floaters are tiny specks or cobweb-like shapes that drift across your field of vision. They can be particularly noticeable in bright light or against a plain background, such as a white wall or blue sky. Why floaters appear? Floaters are caused by changes in the vitreous, the gel-like substance that fills the inside of your eye. During cataract surgery, the vitreous can shift, causing floaters to become more noticeable. Dealing with floaters. While floaters are usually harmless, they can be annoying. Most people learn to ignore them over time, but if they significantly impact your vision, consult your surgeon. In rare cases, a procedure called a vitrectomy may be recommended to remove the floaters. Posterior capsule opacification, the hazy aftermath. Posterior capsule opacification, PCO, is a common side effect that can occur months or even years after cataract surgery. It's often referred to as a secondary cataract, because it causes vision to become cloudy again, similar to the original cataract. The mechanism of PCO. During cataract surgery, the cloudy lens is removed, but the thin membrane that holds the lens, the capsule, is left intact. Over time, cells can grow on the back of the capsule, causing it to become cloudy and impairing vision. Treating PCO. Fortunately, PCO is easily treatable with a quick, painless laser procedure called YAG laser capsulotomy. The laser creates a small opening in the cloudy capsule, restoring clear vision almost immediately. Light sensitivity, the unwanted sensation. After cataract surgery, some patients experience increased sensitivity to light, known as photophobia. Bright lights can cause discomfort or even pain, making it difficult to spend time outdoors or in well-lit environments. The reason behind light sensitivity. Light sensitivity can occur due to inflammation or changes in the eye's structure following surgery. It's often temporary and improves as the eye heals. Coping with light sensitivity. Wearing sunglasses with UV protection can help reduce discomfort when you're outside. Indoors, use soft lighting and avoid staring at bright screens for extended periods. If light sensitivity persists, consult your surgeon for further evaluation and treatment options. The emotional impact, navigating the unexpected. Beyond the physical side effects, cataract surgery can also have an emotional impact. The anticipation of improved vision can lead to high expectations, and when side effects occur, it can be disappointing and frustrating. The journey of acceptance. It's essential to give yourself time to adjust to your new vision and the changes in your eyes. Understand that healing is a process, and it's normal to experience ups and downs along the way. Stay in close communication with your surgeon, and don't hesitate to seek support from friends, family, or a counselor if needed. The importance of informed consent. Informed consent is a crucial aspect of any medical procedure. Before undergoing cataract surgery, it's essential to have a thorough discussion with your surgeon about the potential risks and side effects. Ask questions, express your concerns, and ensure you have a clear understanding of what to expect. The role of your surgeon. Your surgeon plays a vital role in guiding you through the cataract surgery process. A skilled and experienced surgeon will not only perform the procedure with precision but also provide comprehensive pre- and post-operative care. They should be transparent about the potential side effects and work with you to address any issues that arise. Preparing for cataract surgery. To minimize the risk of side effects and ensure a smooth recovery, proper preparation is essential. Here are some tips to help you get ready for cataract surgery. Pre-operative evaluation. Before the surgery, your surgeon will conduct a thorough evaluation of your eyes. This may include measurements of your eye's shape and size, as well as an assessment of your overall eye health. Be sure to provide a complete medical history and inform your surgeon of any medications you're taking. Follow pre-operative instructions. Your surgeon will give you specific instructions to follow before the surgery. This may include using prescribed eye drops, fasting for a certain period, and arranging for transportation to and from the surgical center. Adhering to these instructions is crucial for a successful outcome. Post-operative care. After the surgery, proper care is essential to promote healing and reduce the risk of complications. Here are some tips for post-operative care. Use prescribed eye drops. Your surgeon will prescribe eye drops to prevent infection and reduce inflammation. Be diligent in using these drops as directed, and avoid touching your eyes with dirty hands. Protect your eyes. Wear the protective shield provided by your surgeon, especially while sleeping, to prevent accidental rubbing or injury to your eyes. Sunglasses with UV protection can also help reduce light sensitivity and protect your eyes from bright sunlight. Avoid strenuous activities. In the days following surgery, avoid heavy lifting, bending over, and strenuous activities that could increase pressure in your eyes. Follow your surgeon's guidelines on when it's safe to resume normal activities. The road to recovery. Recovery from cataract surgery is a gradual process, and it's essential to be patient and give your eyes time to heal. Most patients experience significant improvement in their vision within a few days, but it can take several weeks for your eyes to fully adjust. Follow-up appointments. Attend all scheduled follow-up appointments with your surgeon to monitor your progress and address any concerns. These appointments are crucial for ensuring a smooth recovery and optimal results. The bright side, the benefits of cataract surgery. Despite the potential side effects, cataract surgery offers numerous benefits that can significantly improve your quality of life. Here are some of the positive outcomes you can look forward to. Improved vision. The primary benefit of cataract surgery is the restoration of clear vision. Colors appear more vibrant, and you'll be able to see details more clearly, enhancing your overall visual experience. Enhanced quality of life. With improved vision, you'll find it easier to perform daily activities, such as reading, driving, and watching TV. This can lead to greater independence and a better quality of life. Reduced dependence on glasses. Many patients find that they need glasses less frequently after cataract surgery. Depending on the type of IOL used, you may achieve excellent vision at multiple distances, reducing your reliance on corrective lenses. Conclusion: navigating the journey. Cataract surgery is a transformative procedure that can restore your vision and improve your quality of life. However, it's essential to be aware of the potential side effects and take proactive steps to manage them. By staying informed, following your surgeon's instructions, and being patient with the healing process, you can navigate the journey with confidence and achieve the best possible outcome. Remember, the road to clear vision may have a few bumps along the way, but the destination is worth the journey. Embrace the adventure, and look forward to seeing the world with newfound clarity and brightness. Like and subscribe to the channel.